And what we're going to do now is to hear from Meghan Malley and Steve Styes from the Recovery Project, who are physical therapists. And the talk is entitled Learn Techniques for Exercise in Your Home for Gait, Balance, Stamina, Mobility, and Chair Exercises, How to Use Weights and Do Cardio. I think that we're in exactly the right place at the right time, because we just had a talk not long ago about the fact that physical activity is extraordinarily important in Parkinson's disease. And I particularly like Dr. Korkos's comment that if there was a pill that had all the benefits of exercise, people would be taking it religiously 4 times a day. And I think that this is a very timely discussion, which we very much appreciate.
So I am super excited to be following Dr. Korkos's presentation, because that's what Steve and I are going to talk about, is the importance of exercise, which many of you just heard about if you were in the last presentation, but then how you can modify that and do things in the home, what programs are available in your communities, and how that relates to just helping you with your day-to-day function. Let's see if we can get, there we go. So our objectives today are just to review how Parkinson's disease affects the brain and movement, discuss the importance of exercise for those individuals living with Parkinson's disease, to discuss strategies and address balance, gait, strength, and mobility for people with Parkinson's disease, to share exercises that you can complete in your home. So if you are not looking to go out into a clinic or a gym, or maybe not feeling up to that kind of thing, what can you do at your house so that you stay moving? And describe the community exercise programs that are out there specifically for people living with Parkinson's disease. So just as a little review, you've probably heard this a few times today, but I feel like we have to just talk about how Parkinson's disease affects the brain and how it in turn affects the body, so that we really truly understand why exercise is so important if you're living with Parkinson's disease. So how it affects the brain is that the dopamine producing cells in the brain are basically start to die, and you have less dopamine. So what is dopamine? It's the neurotransmitter that's responsible for communication between the cells and the brain. So they help control movement and coordination, among many other tasks that they do. And when we don't have those cells with dopamine and we have less of it, then that's when we start to have a lot of these motor and non-motor symptoms that affect our daily life. So how does that affect the body? And as you've heard this morning, Dr. Patel talked about a lot of the many of the non-motor symptoms, which I'll go over a few, but also the physical symptoms are mainly difficulty with movement and coordination, a resting tremor, which you may see, not everyone has that, but that's a very common symptom of Parkinson's disease, slowness of movement, which is also known as bradykinesia. Stiffness or rigidity is another hallmark physical symptom of Parkinson's disease, and impaired balance reactions and postural control. So normally if somebody goes to, if they bump into you, you might, rock back towards your heels and be able to catch your balance, or take a step and regain your balance. With Parkinson's disease, those balance reactions are definitely affected, and so sometimes, you can't catch yourself at all, and that's how we get a lot of increased falls. Some of the non-motor symptoms, many of which are sensory, so difficulty initiating movement. I hear from my patients all the time, they have trouble just trying to get started, so getting up out of a chair or a couch, how to just get started walking and taking those first initial steps. And impaired proprioception, which proprioception is how you know where your body is in space. So how do you know that you stepped onto an uneven surface? How do I know that I'm starting to lean backwards? So we have cells in our body that help transmit that information up to our brain, and that's affected with Parkinson's disease. So again, that leads to more postural instability, it leads to falls, and a whole host of other difficulties. So some of the cognitive and executive functioning problems that you may experience is just decreased movement preparation. So understanding, for me, I don't have to think too much about if I want to get up from a chair, I just get up and I go. But with Parkinson's disease, that takes a lot more thought and effort, because that automaticity of just getting up and doing what you want to do is no longer the same. Also, decreased ability to change strategies quickly. So if all of a sudden somebody walks out, in front of you and at the end of the grocery aisle, or, a ball is kicked in front of you and you're in the PT clinic, the ability to change your strategies quickly is also very impaired. And another one that's very common is difficulty with dual tasking. So doing more than one thing at a time. You may have noticed that before it was very easy to be talking to your spouse while also jotting down your grocery list, or talking on the phone and doing another task. But that can be very difficult if you live with Parkinson's disease. So that's another area we really like to address with exercise and incorporating that into your exercise program. And then emotional and motivational deficits. So you heard Dr. Patel talk about this a little bit this morning as well. So decline in vigor and motivation, that apathy, anxiety, depression, those are all very common with Parkinson's disease. And we see that a lot with our patients in our clinic, that family members might not quite understand that and just say, I keep just trying to tell them they have to exercise and they just don't care, they don't want to do it. But it's important to understand that that is part of how the disease affects the brain. It's not just somebody, being lazy or unmotivated. It's all part of the disease process, and how can we work to address that. And then also, with what happens with the brain with Parkinson's disease, it implicitly makes people choose smaller and slower movements, which further feeds into that whole problem of Parkinson's wanting to make you small and slow. So as you just heard Dr. Korkos talk about, he really drove a lot of this home, which made me so thrilled to hear him talk about the importance of exercise and not just medication, because research has shown that this is hugely important. So from our standpoint, and what research is showing over the last 10 years especially, is that exercise when it comes to Parkinson's disease is just as important as the medications you take. It needs to be looked at as medication, and that just like you would take your Cinnamon every day, you should be trying to exercise every day. And that what he touched upon is so very true and important, is that exercise is now being shown to make actual changes at the level of the brain, which is really encouraging. It's not just important for our overall health, which we know, but that it's actually changing what's happening at the brain, especially for people with Parkinson's disease. And that is very encouraging. So it's something you can actively do to help, fight against this disease. We know it helps slow the progression of the disease now, which is something we've thought in the world of rehab for a long time, but we didn't really have the evidence to show that. Well, now there's been a lot more research, and we actually have peer-reviewed studies and journals that show it does slow the progression of the disease. And what we're starting to believe is that could it potentially reverse the symptoms? We don't have hard data on that yet, but could you actually reverse some of the symptoms of your disease through certain exercise programs? So just some more information about why exercise is so important, specifically for Parkinson's disease. So we know that the main principles of exercise in regards to PD is that we need to talk about the highest effort possible, the largest amplitude of movements possible, and just the overall principle of the importance of just moving and keep moving. So as far as high effort, like Dr. Korkos talked about, is high intensity exercise. So that can sound intimidating, but it doesn't mean that just because someone can box really hard and fast and stand and do a speed bag that you need to be able to do that too. It just means the highest effort for you personally where you are at your stage of disease. And then the highest amplitude of movement. So Steve will demonstrate some movements here in a little bit, but no matter what you're doing with your exercise, it's about being as big and effortful as possible. We know that Parkinson's wants to, make our posture stooped. It wants to, round your shoulders, pull your head forward. So we want to do the opposite and really fight against that. And then just keep moving in any capacity you can. So our goals, my goals as a physical therapist for exercise from a more clinical standpoint, is to improve that movement initiation, so help you be able to get up and get moving quicker and safer, improve balance, improve your range of motion and flexibility. Since rigidity is one of those hallmark signs of the disease, it can lead to a lot of range of motion problems. So then, people have pain in their shoulders or their neck, decreased flexibility in their hips, which further leads to that stooped posture. I want to improve your walking quality and safety, so that will hopefully decrease your risk of falls. Improve endurance and speed of movements. Decrease fatigue, which we know is a large problem in the population of individuals with Parkinson's disease. And improve your independence with ADLs, so that means activities of daily living. So improve your independence with just simple things that maybe you once took for granted, like putting on your own socks and shoes, shaving, showering, those kind of things that you do every day. And ultimately, improve mood and quality of life. So just to name a few more benefits of exercise, in addition to some of the goals, is that through exercise, these are just a few, but those hallmark signs of Parkinson's, the rigidity, the slowness of movement, the coordination difficulties, that automatic movement, those things are benefits that we know exercise can truly improve. So it's not just our intuition or our anecdotal, things we see in the clinic. This is actually what research has shown. And also improved cognitive engagement. So improving those other non-motor aspects of the disease, like the difficulty with dual tasking or with depression and those types of things. And improved overall motivation. And in addition, as you've heard from a few people, as just adults and aging individuals, you're at risk for all sorts of other health issues, unfortunately. And so we know exercise helps with that too. So cardiac issues, respiratory issues, overall joint pain and stiffness and arthritis and things like that is just another reason why exercise is so important and a benefit you can get from it. So this graphic, I just wanted to, really try to show the importance and how this translates to improvements in your day-to-day life. So we know that we can look at all these wonderful graphs and data about how individuals improve in research, but I wanted you to be able to understand on a more personal level how exercise can actually help you function every single day. So when I talk about movement initiation, that means for you to be able to personally be able to get up easier from a chair, be able to roll in bed easier, to be able to sit wherever you want when you go to a friend's house and not avoid that soft chair or that soft sofa. Improved gait quality, so how that translates into your daily life is just safety with walking and decreased risk for falls and being able to not avoid where you want to go just because you're nervous about your balance and your walking. Improve range of motion and flexibility, how that translates into your day-to-day life is just decreased pain and stiffness. That rigidity from Parkinson's, I hear from almost every one of my patients that it causes pain, whether it's in their neck or in their shoulders, in their hips or knees. So that can really help reduce your pain. So balance reactions, when we talk about what does that translate to in your day-to-day life? If we improve your balance reactions through exercise, that means not only are you at a decreased risk for falls, but you're able to do more things, such as walk on uneven surfaces, which means maybe playing with your kids or grandkids in the grass, or be able to handle crowds. So going to, the mall or going to a grandchild's, graduation and not having to be fearful about what if someone bumps into me. Or unexpected environments. So as Dr. Korkos mentioned, we want you to be safe in your home, but we don't want you to be homebound. So you can't have a predictable environment all the time. So working on your balance reactions and working on your walking ability allows you to go into unexpected environments, go to a restaurant, go to a friend's house, and those are things that are important to a good quality of life. Improved endurance translates to just your ability to keep up with family and friends. I often hear from people, they feel discouraged that they don't like going out anymore because everyone has to wait for them and it draws attention to themselves. So this is another great improvement in day-to-day life. Improved speed of movements means less time and effort for your activities of daily living, so you don't feel so tired from just getting dressed in the morning and you're ready to go enjoy other things. Decreased fatigue can translate into your ability to return to work or hobbies, get back on the golf course or go shopping with friends, whatever you enjoy doing. And improved independence with ADLs translates to just your ability to be able to bathe and dress and do the things you need to do without help, which is huge for just feeling independent and not as reliant on other people. And overall, improving your mood and quality of life translates to obviously living the best life you can. And that's what we really want to stress with exercise, is that this is something you can can truly do for yourself, that can improve your overall quality of life to allow you to lead the most independent and best life that you're able to. So with all of that background info, Steve's going to go over some exercises you can do from your home and from your chair. And as Dr. Korkos pointed out, there are many, many amazing ways you can exercise. There are just a few we have time to give you an overview of today. So Steve's going to start with some of the power moves.
Hi, everyone. You hanging in? Yeah? Okay. So, power moves. Just to give you a quick overview. Has anybody done power at all? Know about power? Cool. So, power stands for Parkinson's Wellness Recovery, and it was developed by Dr. Becky Farley. And really, it focuses on big movements, using loud voice activation, and just a big amplitude and high intensity movements. But they're also functional exercises, and you perform them seated, standing, lying on your back, lying on your stomach, and on all fours. So we're going to focus on the ones when you're seated today, so I won't make you get on the ground on all fours. So, okay.
Oh, I can advance your slides for you.
Thank you.
Yeah.
So Megan's going to manage the slides. I'm going to have all of you, here, let me get my speaker going. Can you hear me? Yes? All right, great. Back away from your tables a little bit. Let's
We know
move.
you just ate lunch, so we got to wake you up,
Yeah,
get you moving.
let's move a little bit, okay? So you can take a seat, but away from your table. If you can, you want to turn and face me as much as possible. So the first power move, and this is something we use in our clinic as part of therapy. We also have group classes. It functions very well as a group class, and it's very motivating to get together and socialize with a group of people, but it also forces you to do things bigger and with more intensity. So start by sitting away from the back of your chair. Step your feet nice and wide. Okay, you want your hands on your thighs for a little bit of support. Okay, nice long spine. Oh, fixing a light. All right. So hands on your thighs for a little bit of support. We're going to lean forward in your chair like you're going to reach down and pick up something off the floor. Okay, and then lift up, and you're going to open your arms out wide. Okay, we want to open up through our chest. Squeeze your shoulder blades together. Okay, and then you really want to add some activation to this. So we could do it like this, sort of half-hearted, but you really want to reach, you really want to extend your fingers. Sometimes people will call it a finger flick if you want to really open your fingers wide. Okay, so we're going to do 10 of those, but I want you to count really loud with me, all right? Let's go. So we're going to go down and lift up, and this is 1. Good. Down. 2. Down.
3.
Down.
4.
Great. Down.
5.
Down.
6.
Down.
7.
Down.
8.
Down.
9.
Down.
10.
Awesome. So the next is our power rock or our power reach. You want to bring your right arm onto your right thigh. Okay, you're going to lean into it a little bit. We're going to reach our hand up towards the ceiling. Okay, and this helps with our mobility here, and it helps our balance. Again, remember that this is something that you do seated. So when you need to reach across the table for something, you need to lean. You need to be able to support yourself that way. But it's also something that you can do standing. And when we do that standing, we're challenging our balance a little bit more there. So sorry, I got off track. Bring your arm under your thigh again. Reach your left arm up towards the ceiling, and then look up at your fingertips. Can you wiggle your fingers? All right, really stretch. So this is 1. And we're going to reach up on this side, and this is 2. Good. 3, 4, 5, 6, 7, 8, 9, 10. Stop there. We're going to do 10 more of those, but we're going to count backwards from 20 by twos. All right? So we're just going to add a little bit of a mental challenge to test our cognitive abilities.
Right.
All right? So right arm on your right thigh again. Let's reach up, and this is 20, 18.
16.
Good.
14.
Nice.
12. 10.
8,
6. 4.
2, 1. Awesome.
Funny how that got a little quiet when you
Yeah,
had
a little
to count
bit.
backwards by two. So you were good. I heard you. But that's what we're talking about, dual tasking and cognitive engagement. So this is a bonus you can add into your exercises from home. Challenge yourself to do those things so you get your bang for your buck with your exercise.
Absolutely. And you're just trying to keep it a little more interesting for yourself. So, third one in the chair, arms wide. All right? And we're going to play a little brain game here as well. So, we're going to twist. All right? You still want your feet wide. You're going to twist your torso. Bring your left hand over to your right. All right? When we go to the right, we're going to count 1 to 10. All right? And then open up in the middle. When we go to the left, we're going to use the alphabet and go to A. So it'll be 1, A, 2, B. Got it? All right? Arms wide, feet on the floor. When you twist, be careful that you're not wrenching your knee. You can drop one knee a little bit if you need to. Okay? You ready? So let's go to the right, and this will be 1, open, A, open, 2, open, B, open, open, C, open, 4, open up, D, open, 5, open, E, open, 6, open, F, open, 8, 7, sorry, open, 8, open, 9, open, open, 10, open. Good, nice job. So you can see it gets a little challenging to do that.
Good job. You're good.
Nice. All right, so now what we want to do is bring our feet together. And this is our power step. And think about when you're sitting in a chair or you're in a car. I always use this example. You need to be able to get your foot up and over the lip at the door, maybe bring your other foot over before you can stand up and get out of the car. So that's what we're practicing here. We want to lift our leg up high, get your foot way off the ground. We're going to step it out to the right. Let's bring it back in, then do that on the left. Out and in, all right? So that will be 1. We'll do 10 of those, okay? You ready? Start with the right. We're going to go out, in, out. 1. Good. Out, in, out.
2.
Nice.
Out. In.
Really loud.
Out. 3.
Good. Out, in, out. 4. Out, in, out. 5. Out, in, out, and
6.
good. Out, in, out, and
7.
out, in, out, and
8.
out, in, out, and
9.
one more, in, out, and 10. All right, is that warming you up a little bit? Okay, so things to do at home to make it a little more challenging, a little more interesting. We talked about obstacles to use. You can use whatever you have handy at home. Yoga blocks are great, but in that seated stepping motion, if you take yoga blocks, put them on the sides of your feet here, you've got something you need to avoid. I need to lift my foot up and over, or I'm going to be kicking the block and the dog's going to chase it or whatever. All right?
Books work great for this. You can use a book. You
Yep.
can use anything.
Stack of books, anything that you've got handy. All right? So the same thing. You're lifting out and in, and then you can change it up. If I don't like you know, I'm bored doing that, try it a different way. Do out to in, in to out. You can add a pop at the end. You can even do that turning like we did, we were talking about for the car. So that stepping out, you know, step out, do a sit to stand and stand up. Sit down, come back in, okay? And that's gonna get your heart rate up if you do that for a little while. So some other things, just sticking with the power moves to start with. Again, these are cones. You could use a can of corn or whatever you have handy. All right, on the sides of your chair. So you've got a target for something like the power reach. Okay, I'm gonna reach down now and tap it. Okay, and then I'm gonna reach to the other side and tap it. So I get that nice lean, that extension, and I'm reaching for something. You could use Post-it notes on a wall. So if you're in a corner, Megan had this suggestion, put yourself in a corner, and when you do things like the power up, you can be reaching and you're going to be touching the back of the corner. So you're far enough away that you're forced to make that big extension, because without that feedback of, you know, actually touching something, a lot of times we think we're doing something big, but I'm really not. Okay? All right. So, whoops. Another thing, and I love these to use, these are called boom whackers. You can get them on Amazon for a set for less than $20, I think. But pool noodles that you can buy at, what?
The dollar store.
The dollar store, 5 and under or whatever for $1 each. Cut them in half, you've got them. They're fun to use for, you can actually do all of those power moves with them. So my power up can be something loud and noisy and obnoxious by hitting down and hitting up, hitting down, hitting up. My twist, I've got that, I've got the reach, you know, things like that. So, and again, put a target on the floor. So my target is way out here and I really need to reach over there. Just don't fall out of your chair. Okay.
The nice thing about these too, if I can just add, is that it helps you with that feedback, that auditory feedback, to know, are you really giving your whole effort? Are you hitting those as hard as you can? Because remember, with Parkinson's, it affects your ability to know how big you're moving and how loud you're speaking. So if you can hear like, oh, that wasn't as loud, it just helps you give that feedback to keep pushing yourself. Because if you're at home and you're doing these exercises, you don't have a trainer or a PT there telling you to be bigger and be louder. So these are just little tools to help you kind of keep pushing yourself at home if that's where you're going to be exercising.
What's next?
Oh,
hand weights?
Yeah, oh, yep,
All
hand
right.
weights.
So hand weights. So again, power moves. If you really want to make it more challenging and add resistance exercise to what you're doing, again, you can use the power moves. Obviously, that's not the only thing you can do, but our power up with some hand weights that you can pick up anywhere. Again, 5 and under is where I buy all my stuff. You're going to lean forward and you reach up. And now I've got 5 extra pounds on each hand. Okay? And then you can actually gradually increase that rate. And you'll be surprised at how much that does for you, how quickly you can start becoming fatigued, but you're building strength when you do that. Okay? Does that make sense?
Talked about hand weights with boxing.
Hand weights for boxing. So we'll move on from the power moves, but we run some Rocksteady Boxing classes. We have the whole program at our clinic, and we do these types of things all the time. And so even in a chair, a great cardio exercise is just punching. So you're punching, but I'm also getting that nice big extension through that. By adding weights, okay, I'm adding some more resistance to it. So I can just sit in my chair and you can sit and punch. And I've done this in classes. Do this for 2 minutes and your heart rate is going to get up to that 80% that you need it to get up to. It's a great warm-up.
a great way to incorporate that, just, we know we all say we don't have time or whatever. If you have a favorite show you watch, challenge yourself during the commercials. Do that during a commercial break. Just leave a light set of weights or no weights and just start without weights. And then, as Dr. Korkos talked about, the importance of progressive resistance exercise, then from there, see, can you fill a little water bottle with water and start doing it with that? And then you can build up to some weights. So just try to think of ways to incorporate this into your day-to-day life if you're finding it hard to get out and exercise as much as you would like.
Absolutely. So that was a seated punch. Okay. So seated punching, I always encourage people, if you can get up out of the chair, then get up out of the chair. And so we can do a boxing drill, a boxer squat. So I'm going to keep my feet pretty wide. You want them at least hip width apart or more. Use your weights. So you're going to hold them up towards your chin like you're protecting your face with your boxing gloves. You're going to squat down and then reach and punch. Okay? So now I have a real balance challenge here because I'm shifting my weight. I've got added weight because I've got this, and I'm getting that nice extension, a nice torso rotation when I do that. Okay? And again, this for a minute, 2 minutes is really going to get your heart rate up. You're going to get that endurance, high intensity exercise that you need.
Ankle weights?
Okay. So other options are things like ankle weights. All right, this one's kind of a heavy-duty one. They make really nice padded ones elsewhere. But you can use these. These ones just Velcro around your leg somehow. So now I've got 5 extra pounds on my leg. Okay, so sitting, nice thing to do. Leg extensions. You want to build leg strength. So your quadriceps here. You can just sit in your chair and do some leg lifts. All right. You can do that standing. So if I'm stepping, all right. Again, extra weight on my legs because of the ankle weights. Another great option, because it's also a core strengthener, is something like bringing your elbows to your knees, so you know bicycles or crunches. Have an ankle weight on, have wrist weights on, and you're crunching up. Okay, like that. You can do that in a chair. You can do that on the ground. Obviously, you could even do that standing. I'll take that up. So, fatigue, especially if you haven't exercised much. I'm going to turn this one up. You know, you're going to get fatigued. Your body needs to build up to that activity. All right. So exercise actually has been shown to reduce the feeling of fatigue. You know, there's no way around it. To start with, you're going to get tired and going to be worn out after a workout. You know, take a day of rest and then get back to it. You want to keep moving, and you're going to find you'll have more energy if you stick to it. Divide your exercises throughout the day. So I don't have to do that 30 minutes in one chunk. All right? I've got 5 minutes here. I have 10 minutes there. Add those in, and it adds up. Do a few reps is better than no reps. So, you know, a little is always better than nothing. You got 10 minutes, you know, even if you're just going for a walk, do a few of those. Like Megan said, do it during commercials if you're sitting watching TV. And then just do the best you can with as much effort as you can. You know, in yoga, we always like to talk about the practice of yoga, you know, meets you where you're at, okay? I have limited abilities. We all have a limit somewhere. And, you know, you do what you can do. And that's the same with really any type of exercise. Okay. Just enter.
To the right.
You can do it. Thank you. All right, so what is available in your community? So physical, occupational, speech therapy are available here at the Recovery Project where Megan and I work. We offer all of those. Power programs, have them here, Henry Ford, they're also all over them. Those we were doing some of those. LSVT, loud and big therapy is another option in the community. And then Rocksteady Boxing is really popular right now, and it's a lot of fun. And I should say that that's probably the most important thing. The best exercise for you is the exercise that you're going to do. Okay, so you need to find something that you enjoy doing and mix it up. So we don't have yoga, but yoga's on there. We offer yoga classes. Tai Chi is a great thing. There's pedaling for Parkinson's. There's dance programs for Parkinson's. So find something that you enjoy, and I always want to encourage people to mix it up. You know, your boxing classes, they're great. They get you sweating, they get your heart rate up, they build strength, but balance that out with something like Tai Chi or yoga, where it's a slower, very mindful movement that still requires some strength because you've got your body weight to deal with, but it just calms things down a little bit and it creates balance within your body.
Great. So we also just wanted to share, we have to shamelessly plug this, that for Steve and I, you know, we're super passionate about helping people with Parkinson's because we really believe that exercise is so beneficial, and we think that everyone should have access to it. It can be totally free. You know, Mary Sue charged us with showing you things that you can do from your home, but there's also so much available in the community, like Steve just mentioned. And we want everyone to have access to these amazing programs because we really see every single day how they help people. And Mary Sue had told us that, you know, at the Michigan Parkinson's Disease Foundation, they're one of the biggest things that they hear about often is that people don't feel like they have the funds to pay for these wonderful programs. They might be on a limited income or had to retire early due to their disease. So what we've decided is that this year we're going to try to do our very first fundraiser that we've entitled Take Power Over Parkinson's. And this event takes place at the Recovery Project, but it's not really affiliated. What it is we're going to just try, our goal is to raise $10,000 to provide anyone living anywhere with Parkinson's disease to be able to have money to go to wellness classes of their choice. So if you live in Toledo and you want to go to a Tai Chi class there, we want to be able to help you pay for it. So what we're doing is that we're doing kind of a fitness fundraiser, if you will. So we're going to have Rocksteady, power, yoga, Tai Chi for Parkinson's, and a dance program, moving through dance for Parkinson's, all at this event where everyone that comes, whether you have Parkinson's or not, we're encouraging anyone in the community to come. And you get to sample each of these programs for about 20 to 30 minutes and just see what it's about, see if you like it. And with that, it's a $25 registration, and we're hoping with people will raise money, you know, through their this fundraising page to help build a scholarship program so that if you have Parkinson's disease, you can apply and have money that we raise that day be granted to you so you can go to these wellness classes wherever you choose. So this is just a little flyer about the event. There's more of these flyers actually at the table right outside the door here at the Recovery Project booth. So please, if you're interested, check it out, or you can go online to the website there and just share that with people. And if you know someone with Parkinson's disease that's not here, or you yourself, you know, are interested in this, that you can't come or you're not able to donate, but you want to apply for a scholarship for wellness money, please just give us a call or contact us through this website, because we would love to be able to award people money so that they can exercise, because everyone should have the ability to do that, and we don't want the cost to be a barrier. So just had to throw that out there for you all. And lastly, did it go? There we go. Yep, so lastly, just like Steve said, there are a lot of programs out there, a lot of clinics, a lot of wonderful gyms, a lot of Rocksteady affiliates, all of that. This is just where we happen to be. We are at the Recovery Project, and we have clinics in Lansing, Livonia, and Clinton Township, and we really specialize in Parkinson's disease as well as all other neurological diseases. And so whether you are interested in LSVT big or loud, power program, Rocksteady, adaptive yoga, one-on-one personal training, anything like that, just know there are so many resources out there, including here at our location. So with that, I'd love to open it up if you have any questions about anything regarding exercise, whether it's in the home or the community. Yes, sir. Yeah, so the question was, do you have bags, like heavy bags you hit in the boxing class? Yes, we like to stress that it's non-contact boxing, so people with Parkinson's aren't fighting each other. So you do, we use heavy bags, we use speed bags, we use all sorts of other fun props. We have many coaches at our clinic, and we all teach the classes different days and times of the week. And we make it different and fun every single week. We incorporate cognitive challenges, we incorporate sensory challenges, and we use all sorts of equipment. But every time we actually make contact with anything, whether it's a speed bag or a heavy bag, we always have gloves and gel wraps over our hands so that our hands are protected. But yeah, the contact against the bag is so important because that helps with your strength and it helps with your power, and that is definitely something we do every single class. Any other questions? No. The only person that actually might take a few body blows is Steve, because I make him wear this like padded suit so people can hit him. But that's it. Yeah. Right. Yeah. You and me both wish that was true. But unfortunately, most insurances, they'll pay for physical therapy. Usually with your coverage, you get, depending on your healthcare plan, obviously, you get physical therapy services, occupational therapy services, speech therapy services. But as far as wellness programs, it's not something that our insurance system covers. I wish that was the case. But that's why, at least at our program, we really try to keep the prices as low as possible. We're really not creating our wellness programs to make money. It's really just to make sure that no one with Parkinson's disease slips through the cracks and doesn't have access to keep moving. But I agree with you. It's really unfortunate, but as you know, our healthcare system sometimes isn't built as a preventative system. Yeah. Yeah, the good thing is that if you go somewhere for therapy that specializes in Parkinson's disease, we incorporate these programs into one-on-one therapy. So by all means, utilize your physical therapy services that you get every single year. And then if you exhaust those, that's when the wellness programs are so important. But you're right, the insurance companies look at it as what is absolutely medically necessary for you to function in your home, and they don't sometimes understand that with neurological diseases, you need to exercise day in and day out for the rest of your life. So we get frustrated by that too. Yeah, in the back. Correct. Yep. Yeah. Yeah. Yeah, that's a good question. So with Rocksteady Boxing, you definitely have to, be careful if you have other medical issues and comorbidities, but we do a screening process for everybody before they start the program, and we go over thorough medical history. If we have any concerns, even though you don't need a prescription from a doctor and insurance doesn't pay for it, we'll send for a clearance form to the doctor. But if somebody's on blood thinners or, they're not getting hit themselves and bruised and things, but hitting on their hands. So with everybody, we really try to make sure safety is number one. So if that's the case and we need to modify it, and that maybe you're just doing what we call shadow boxing and boxing like in the air, we can do that. So the nice thing is that it can be modified for anyone at any level of disease. And at our particular location, our classes are run by physical therapists, and so we know how to modify everything. Yeah. Yep, go ahead. Definitely. So those moves that Steve did were based on the POWER program, which is PWR, Parkinson Wellness Recovery. And their website and their YouTube channel is a wealth of knowledge. And that is PWR and then the number 4, life.org. And they have wonderful programs, and all of their exercises, they actually demonstrate on YouTube videos and things like that. So that's a wonderful website. And then I believe as far as if you're interested in LSVT, that website is lsvtglobal.com, and Rocksteady, I think, is just rocksteadyboxing.com. And you can look up affiliates in your neighborhood and your area and see where they teach those classes. Yeah, that's a good question. We definitely provide, you know, a lot of rest breaks as needed. So we're trying to push people, but obviously within a safe range. Yeah, you know, if you can keep that up, that is excellent. I think if you need a rest break, we try to just take a quick little bit of water, a couple second break, 10 second, 15 second, and you just want to get back into it to try to keep that heart rate up. But yeah, you know, because as we've talked about before, a lot of people have different medical issues and things like that. But if you can keep that up for 20 minutes or 30 minutes, that's excellent. Any other questions? Yeah.
Are you aware of silver sneakers?
Yes, that's a great program.
By some insurance covers for them.
Yeah, you know more about that than me, I think, Steve.
Yeah, so Silver Sneakers it's a Medicare program. Usually, well, it's affiliated with Medicare. Some of the supplemental packages you get with Medicare, that's incorporated in it. And so there are certain places you can go, like the YMCA's usually take that. Some powerhouses, I think Fitness 19s, will take it. And you get that membership at a great discount or for free.
Mine is free.
Even. Yeah.
Great.
And it's a great thing that they offer. There's a process to go through to get authorized to do that, and they really limit that.
It's not all insurance though.
No, it's not
Right,
all
it's just
insurance.
Medicare,
You need to check with your plan to see if that's something available.
Yeah, God. Go ahead, Mo.
First of all, thanks, Steve and Megan, great presentation.
Thank you.
Is there any, with the home exercises, any concern about doing them wrong and exacerbating injuries? I'm thinking particular children.
Yeah, that's a really good question. I think we get this a lot I hear it a lot from people that I see in physical therapy that I give these exercises to for like their home program, and they come back and say they're really concerned that they're doing it wrong. My thing is, like, I just want people to move and move as big as they can and as much as they can. I don't care if you're doing these exactly like Steve did, or you're just like waving your hands like a crazy person above your head. Like, as long as you're moving, great. But with that said, it shouldn't be painful. So if you have a shoulder condition or any condition and it's painful, that isn't what we want. Parkinson's is not a no pain, no gain type of scenario. So if you have pain, it should be modified. So if you can only raise your shoulders to here, then before pain, then that's all you should do. And that's when we really say, go in to see a PT or have a PT come to your house, because you really should do that one-on-one therapy first, and so you can try to help with those orthopedic issues and then hopefully be more successful on your own. But that's a good question. As long as you're moving and moving with as much effort and pain-free hopefully as you can, that is ideal.
You need to listen to your body and modify as you need to. We have people
Right.
that, shoulders, knees, hips are always the bigger issues, and so just take care of yourself, but move.
Right. Yes, sir.
I participated in the Rocksteady Boxing and Dysfunction.
Oh, great.
And I've been to back surgeries, and I can do it all.
Awesome. You should come up here and be our poster child. That's great. Yeah. So like he's mentioning, we know everyone's got, usually, it's very rare to have somebody come in that has no other issues, whether it's orthopedic issues or other medical issues. So we definitely can modify things. We always have at least 2 coaches in every class, so that if someone needs something modified, they can have somebody with them kind of just making it tailored to them, which is really nice. So thank you for sharing that. Any other questions? Yeah. Yeah. Yeah, so I think on the Power website, you can actually order the pages of the exercises, and they'll send them to you. Yeah, good question. Anybody else? Yeah. Of some of these programs? Yeah, do you want to share that about the wellness classes?
Yeah, so, and it varies depending on where you're going. Our classes that we offer are either $15 for an individual class, or you can buy a package of 10 for $135, and they don't expire. You can use them as you need to, and the classes aren't built upon each other, so you can come and go as you please. We really recommend trying to come 2 times a week, 3 times a week, as much as possible. But that said, I know some places they're gyms, and they have a gym membership that you have to apply. And then there are some places that offer classes within senior centers that can be much less expensive. So we try to keep the cost low, but we tend to be kind of middle of the road.
Yeah, and our Lansing clinic right now this summer is offering free classes just to kind of get their program going. So that's an awesome option too. So it's kind of about just doing a little bit of research. Yeah. What's that? Oh, good question. Yes. So our power classes are for 1 hour. Our adaptive yoga is for 1 hour. But our Rocksteady Boxing classes are actually 90 minutes. But that sounds really intimidating to a lot of people. It's not just really high intense boxing for 90 minutes. It's broken into thirds, like kind of some really active warm-ups and stretching, and then really the bulk of the boxing workout is the next 30 minutes, and then the final 30 minutes is some core exercises and some cool down. So it's 90 minutes, but it's broken up. Yeah, in the back? You want me to repeat the website for Power? Sure, it's PWR and the number 4, and then life, life.org. You're welcome. Yes, sir.
In terms of improving balance, would you consider golfing as something that would help it?
Yeah, golfing's a huge thing. A lot of our clients want to get back to doing. The tricky part with balance, as a PT, I get nervous about someone like wanting to work on balance on their own, because really if you're trying to work on balance, I really would rather be like spotting you and making sure you're okay, But if golf is something you enjoy and you're safe doing it, it's excellent because you're having to stand on uneven surfaces, you're having to rotate and work on that trunk rigidity, you're using power in your swing. It's good just for your overall psyche to get out and do what you want to do and what you enjoy and be outside. So if you're not having pain from the rotation and from the golfing and you're not falling, then I think it's an excellent thing to do. If you are falling or having pain, that's when you should go to PT and say, I'd really like to work on this. And then I love to incorporate things like golf swing into my PT, or put people on foam that, kind of mimics being on grass, and working towards getting you back to the golf course. But it's an excellent activity if you're safe doing it. All right, great. Yeah, I say keep doing it, especially if you enjoy it. And if you stop, your golf game's going to really suffer, so you might as well. Oops, I might have got. I'm gonna stay out of your debate. Any other questions from anybody? Yeah. Yes. Hi, Terry. Yes.
But to do the wellness classes, do you have to come and get evaluated first, or do you just start?
Excellent question. Yeah, that's a great question. She asked if you want to come to wellness classes, do you need to be evaluated? Yes, we do ask to screen people if they haven't been a patient in our clinic or haven't been a patient in our clinic in a while, just because we want to make sure that you're medically stable, that someone didn't just, have a massive surgery or something like that. So we ask you just give us a call, and we set up just a 30-minute brief screen where we can just do a few tests and measures and see. Also, the other thing is, like, for Power and Rocksteady Boxing, there's different levels of those classes, because we didn't want to put people in the same class that maybe someone's highly active and a runner, and then having someone in a wheelchair. We want to have split up those classes. So we asked to do a screening just so that we can figure out what's best for you. So yeah, just give our clinic a call. I think, do I have time for one more maybe? Yeah, I'll just take one more question. Yeah. For the screening for Rocksteady Boxing, the screening charge is only if you actually sign up, because then it incorporates your gloves and your gel wrap. So there is a charge for that. For power, there's not, right? Yep, so for power, there's not. We only charge once you sign up to get the materials for the class. Yeah. Thank you so much for having us, everyone.
Thank you very much. It was great. Thank you.